Yeah, I'm super excited to see what happens, but your comment about looking at the images really brought that to mind again.
It's really neat. One of the models that I saw was how to incorporate different AI tools to do tumor boards. So our traditional tumor board, we sit around a table, we each bring our expertise. And so, what if you have these models that have learned and they can help you? I mean,
Yeah.
it's just really cool to think about.
So back to your study and
Hmm.
dordaviprone,
Hmm.
how do you communicate, or what was the conversation around maybe the potential benefits and limitations, maybe some
Hmm.
side effects with dordaviprone,
Hmm.
especially considering the side effects, are they different among pediatric patients versus adult patients, and how do you handle that?
There's a little bit of a difference, but when you look at the data sets, they're small data sets, and the pediatric group is small as well. The first thing that I tell people, the way that we classify serious adverse events, or if we have grade 3 or greater events, there were zero serious adverse events. There were zero cases of death due to the drug. And as far as the events that were dose limiting, that was also pretty minimal. In all of our studies where we have patients with brain tumors, we have fatigue and we may have some nausea, but nothing really stood out. In the pediatric group, the blood lymphocyte count came down a little, but there's a striking difference between some of our studies where you have a laundry list of all of these problems that you create with your therapy, and so we're very fortunate that this therapy is well tolerated.
I'm wondering, just can you tell me a little bit about the current understanding of the biology of the H3K27M mutant gliomas, and how does that inform drug development?
Mm-hmm. It's interesting because when I first started working with this drug, we were not sure about the mechanism. So
Mm.
much has evolved. We know it's a ClpP agonist and it's a DRD2 antagonist. So essentially, it helps to adapt or modify the changes to H3K27, which is trimethylated. So the downstream effects are stopped. Um, and this also leads to a response rather quickly, that's evident in the patients.
Um, I would, I mean, just kind of off of that, are there biomarkers or other biomarkers or clinical features that might predict which patients will respond best to dordaviprone?
That's an area where we're trying to learn more. So, one of the limitations that we have, these tumors are deep in the middle of the brain, and so the tissue samples are very small. In one of the studies that's ongoing right now in the pediatric population, they have the opportunity to look at more biomarkers. Something I'm excited about is we're now starting to use more CSF-based biomarkers as well. And so I'm hopeful in the future that we'll know more and we'll be able to predict who would be a better responder. um, Biomarkers have really revolutionized how we treat patients with brain tumors.